Hello, good morning, and welcome to the first virtual and 7th annual CCO Oregon conference. I am Samantha Shepard, the Executive Director of CCO Oregon, and I want to start today first by acknowledging the impact that wildfire, is currently having on so many Oregonians and folks in the West overall. Too many Oregonians and too many Americans are facing one too many things today, and our hearts are with them. And I want to thank each of you that are coordinating care and services for those evacuating and otherwise needing additional supports at this time. We appreciate you joining us, and we're hopeful that next year we're able to be in person. But in lieu of that, we're happy to meet with you all today virtually. CCO Oregon is a statewide nonprofit membership association that brings together experts that drive innovation and systems change for coordinated care. CCO Oregon's vision is lower costs, increased access to quality care and health-related social needs, improved outcomes, and a sustainable workforce across the delivery system through the widespread implementation of the coordinated care model. Our members are the core of our work and include, of course, CCOs, other healthcare payers and providers, hospitals, clinics, as well as behavioral health and oral health organizations. CCO Oregon members convene to discuss new programs, share challenges and opportunities, and identify and advance evidence-based, stakeholder-driven strategies that support the model and health transformation. CCO Oregon maintains group discussions addressing behavioral and oral health, social determinants, pharmacy, and government affairs. Over the past 6 months, we've convened more, bringing together members to draft recommendations, troubleshoot specific implementation challenges, and better understand the rapid changes we're all experiencing. Thank you to all CCO Oregon members for your work, your membership, and your support of today's event. And thank you to our event sponsors. At the platinum level, we have Activate Care and Med Impact. And at the bronze level, we thank Arden Specialty Pharmacy, Kurandi, and Health Management Associates. We have an exciting morning planned for you in 2 parts. In the second hour, we'll discuss value-based payment models currently implemented and on the horizon, and their potential to improve provider sustainability. We'll be joined by Pat Allen from the Oregon Health Authority and representatives from Health Management Associates, Trillium, Pacific Source, Care Oregon, and St. Charles Health System. And in the first hour, we will have a conversation with elected officials making decisions that impact care. We were very excited to welcome U.S. Senator Jeff Merkley and U.S. Senator Ron Wyden. However, both were required to attend a briefing this morning and deeply sent their regrets. But I know if they were here, they'd say thank you. Thank you for your incredible work over the past 6 months and all the days before that and all the days after. Oregonians are better off because of you and because of your work and your dedication. So thank you for your patience, your focus, for not forgetting the greater goals of the system nor the needs of the patient, and for continuing to transform care. We will be joined later this hour by state legislators from the House and Senate that sit on the Ways and Means, Healthcare, Human Services, and Behavioral Health, among other committees. And before that, we have a special message from the governor for you. I hope you enjoy the conference, and please, let's now hear a message from Governor Kate Brown.
Hello, CCO Oregon. Governor Kate Brown here. I'm so glad you could make time to attend this virtual event. You all have been working tirelessly to provide health services to Oregonians. Thank you, thank you, thank you. Coordinated care has played a vital role in ensuring that over 1 million adults and children have life-saving and preventative health care. I remember when the late, great Senator Bates introduced the bill to create CCOs, which saved money and mended the gaps in our state's healthcare fabric. The notion of coordinated care was based on a simple concept: the patient. CCOs make smart use of preventative care, which is easier, cheaper, and smarter, and they allow providers like yourselves to drive the system. We know that patient-centered care works. It's a proven mechanism to reach people early and avoid preventable hospitalizations. Studies have shown that for every single dollar we spend in primary care, we save $13. As you all know, healthcare isn't just about when you're at the doctor. It's when you're not at the doctor. Like the patient in Curry County who popped his stitches 2 days post-op by chopping wood. The CCO model made it possible to deliver him enough wood to last the winter so he could heal. Although we've made significant advancements, the COVID-19 pandemic has certainly presented an unprecedented challenge. We are learning to live with the virus, and the new normal will require all of us to continue to focus on people and outcomes as a system of health. The good news is Oregon is weathering this crisis better than most states, and we couldn't have done it without you. You were able to adapt quickly to meet the needs of Oregonians. The pandemic has truly exposed cracks in our healthcare system that already existed, especially for our low-income communities and our communities of color. Now, more than ever, to truly achieve health equity, we must dismantle systemic racism. We call it systemic racism because it is just that, a system, and no sector is immune. We know that Black people are more likely to die from cancer than white people. Black mothers and babies have higher mortality rates than their white counterparts. Latinx Oregonians are less likely to have health insurance and more likely to suffer from chronic health issues like diabetes and asthma. So we shouldn't be surprised that our Black, Latinx, Asian, Pacific Islander, and tribal communities have been the hardest hit by this pandemic. These communities do not have equitable access to quality health care. Racism is indeed a public health crisis. We need a resilient, modern healthcare system that recognizes the structural racism embedded in the fabric of our institution and consciously works to root out those inequities. As we work to build a safer and stronger Oregon, I'm committed to putting our communities of color at the forefront of our recovery efforts and focus on health equity. But you all know, words are not enough. We are relying on dedicated professionals like yourselves to take action. I wish I could say this will all be over soon, but as you've witnessed in the recent weeks, our struggle is far from over and is not likely to wane anytime in the foreseeable future. Positive case counts have stabilized, but are not significantly declining quickly enough for us to have in-person learning and open our businesses throughout the state. The data models and case counts serve as a sobering reminder that we must remain vigilant and collectively work to reduce COVID-19 transmission, especially as cold and flu season approaches. So thank you for your dedication and determination to serve the people of this great state. I hope you will use this conference to learn, reconnect, and re-energize because we're in this for the long haul and Oregon needs you. So have a great conference.
Well, hey everyone, thank you for joining us today. I think we have a really incredible panel of state elected officials and want to thank the governor for her remarks today. And first and foremost, hope everyone is being safe, not only with what's been going on over the last year, but obviously what's happening the last couple of days, and really appreciate many of the elected officials today helping out their constituents, and appreciate everyone joining us today. So just as a couple of introductions for those that are here, and then we'll sort of just open it up and get moving here. So just a couple of rounds. So we have Representative Andrea Salinas from House District 38, Representative Christine Drazan, the House Minority Leader. We have Representative Rachel Prusak, Representative Rachel Moore Green, Senator Arnie Roblan, Senator Elizabeth Steiner Hayward, and Senator Tim Knopp. So thank you all for joining, and we wanted to sort of start off with an opening topic that's pretty broad, but wanted to sort of get going and start the conversation this morning. So the first part of this conversation is really about health transformation in the state budget, and wanted to lead off with one who has her fingers very much in the state budget. So this will be a starter for you, Senator Steiner Hayward. How do you see the gains that we've made around health transformation and improving access to care across all pairs and the current budget reality and the pressures that we're facing moving forward in the next budget. And then I'll also ask Representative Drazan and Salinas to add some comments as well in this section. So Senator Steiner, Hayward, will you lead us off on this section?
Sure, thanks, Sean. I appreciate the opportunity to talk with everybody today. Clearly, we're going to be facing huge challenges maintaining the budget for the Oregon Health Plan and for advancing some of the major public health transformation that we've been accomplishing over the past several years. And I think another area that we have to think about a lot, and I know we're going to be talking about this more in a little bit, but I do want to mention it, is changes in behavioral health. We know that Oregon has historically been dramatically underserved. And I know we're going to talk about this more, but I want to put this on the list as something where we have to be paying attention to how do we pay for it and how can we find the resources. But I think more importantly, this may give us some incredible opportunities. We recognize COVID has laid bare substantial weaknesses that we all, I think, sort of knew existed in our health systems. We're paying for care that isn't evidence-based. We are not paying for care that people should be getting. We're paying for the wrong kinds of care in the wrong places. We have learned from this crisis that telemedicine works for a large range of applications and can probably be used much more broadly to improve access and reduce cost. We have learned that maybe we don't need to do as many procedures. There are a lot of teachings that we can take from this. And I think the biggest one also is that we have to make a lot of investments in overcoming health disparities. And it sounds odd to be saying that we need to make investments at a time of budget crisis. But I do really believe that if we don't make these investments now, when it's so clear what we're all facing, we're going to be even further behind the next time we run into a crisis like this.
Representative Drazan, welcome. Good to see you.
Hi, thank you. It's good to be here.
Do you have any comments for us here in this budget crisis and how we sort of move forward in this environment and continue the gains that we've made as a state and as a community in healthcare and access?
Yeah, I caught the last half of Senator Steiner Hayward's comments, and she has such an extraordinary amount of personal expertise in this category. I have to say that as we move forward in the budget challenges that we're going to face in the years ahead, I think the most important thing we can do is remember the core functions of government and to continue to be really, really disciplined about funding the things that make the most difference for people right now. And I think that is going to be the challenge, because when it comes to our health right now, I want to echo what Senator Steiner Hayward said. I mean, in this COVID environment, I think we've all learned a lot about how much we take for granted and how much we can affect each other. And so I would just really broadly say that when it comes to the budget moving forward, that we need to continue to sustain and support the areas of our budgets that are going to make the greatest difference in the lives of Oregonians. And I think that the thing too, that Emergency Board recently took action to address some issues around social determinants of health. And at the time, I was surprised that they didn't work through CCOs to do that work. I followed up and asked some particular questions about why that decision was made, and was surprised to hear the answer. And that the answer was that in some categories, CCOs may or may not necessarily have the credibility within some of those communities to really do that work with them and provide that support. And I struggled with that answer, but I do think that in this COVID environment, if we are learning that there are challenges within our CCO system, that this is the time to overcome them and to not hand that work off to other entities, but to really rise to that challenge. So I would have preferred to have that money go through CCOs who have already been charged with that work personally. But I did find it surprising that was at least a perceived challenge that we have right now within our CCOs. And I think it's important to overcome that.
Thank you. And then Representative Salinas, as the leader of the House Healthcare Committee, and with your experience in the healthcare space and also sitting on the Human Services Subcommittee as well, what do you think are the opportunities and challenges moving forward in this environment, leading off of and linking to some of the conversations you've heard just now?
Yeah, so I think there are some things that we can actually build on from some things that we've seen from the CCO. So that I think have been working and are leading us in the right direction, and we need to, continue to figure out how to expand. So providing the flexibility for payment under the global budget for things like health-related services, and I think some of the value-based payment models CCOs have adopted can support that kind of comprehensive whole person care that meets the needs of the CCO and our Medicaid members. I think of this type of flexible spending can address the health inequities that we've been talking about and that Senator Steiner Hayward mentioned and that we've been seeing in great measure through the coronavirus pandemic. So I think those types of things can better support population health and coordination of care. And I think providing a financial incentive for achieving quality benchmarks has had an impact on changing care delivery. And I think, this has been demonstrated through the evaluation of Oregon's waiver. So I think building on work that the CCOs have done, I think engaging community in health system planning so that we don't see the types of inequities. I mean, you hear a lot, the phrase, essentially, don't move policies forward without our involvement. And so I think it's essential in establishing a system that addresses members' needs and promotes health. And as you and I have talked about, Sean, I'm looking forward to the work of HB 3076, so the hospital community benefit bill that passed, and will take hospitals through the steps to align their community benefit with the community health needs. I think all of this work and this is a lot of policy work that's been really critical to making sure that we stay within a budget that can serve the needs of our Medicaid members.
Thank you for that. Just as a little bit of a transition for Senator Roblan and Representative Moore Green, I think on everyone's mind, especially over the last couple of months, is and has been a focus point over the last 2 years, and the structural changes with the legislature in terms of creating a focus on behavioral mental health. Where do you see the opportunities and again, the challenges around behavioral health as we move forward, especially in an environment, not only what we're currently facing for patients, communities, and families, but also for the workforce? So Senator, thank you for your leadership on the committee that you chair in the Senate, but also Representative Moore Green, your passion on the healthcare committee. So Senator, why don't you lead us off here and add some comments about where you think a path forward is on this work?
Yeah, I think we have a lot of work to do, and I really appreciate hearing Senator Steiner Hayward mention behavioral health right off the top, because I think it is the place where we really need to make sure we invest in. We've got a behavioral health group working through the governor's office with a lot of people on it, trying to come up with some recommendations in the near future. As a high school principal, we went through a lot of difficult times when I was down here, and what I would tell my teachers, real change never took place when we had lots of money, because people just threw money at it. The true change always took place when we were in real difficult situations and we had to set priorities based on what was really the most important thing. And I think what the COVID has shown us is that behavioral health needs to move up. We need to make sure that we deal with it. I believe personally that if we can do this right, the money is there. We just put it in the wrong places. So if you look at our prison system, it is the largest provider of behavioral health services in our state, and that's wrong. It should be in providers that really have been trained to do that. And so if we can eventually move some of that money and those patients to appropriate places and identify them early and figure out how to help people. So I think we're at a place in time when we have understood that we really have to listen to others, not just ourselves, that we need to listen to these disproportionately affected people. We need to listen to people who have severe mental health issues. And we need to try to figure out, how do we reevaluate the spending of the money that we already have in the system to help provide for them. The hospital is not the best place for them. We have about 8 working groups right now going on. About 7 of them, or 6 or 7 of them, are all about the judicial system. Our judges are really engaged in trying to figure out a solution for this. The aid and assist fills up our hospital. That is not the appropriate place for all of those people. We need to figure that out. So there are a lot of opportunities in the next few years for people to really evaluate where we're going to go forward and how we're going to spend the money. I believe that CCOs are a really important part of that solution. I think we really need to look very closely at the federal government, who has put a lot of money into a small program that we were fortunate enough to get into with the CCHBCs, so that community-based full care systems. Every place that has had them going in our state and these has spoken highly of them. We haven't had them going long enough to get all the data we need from them, but we need to make sure that we invest to get that 4 or 5 times match from the federal government to find out what's really working and how to make this work. And then eventually look at CCOs and understand how this could be a part of that, because that original vision of CCOs that Kit Sauber expressed over and over again with the heart attack person who was overheated, and if we got him an air conditioner, you might solve the problem. We need to do the same thing in behavioral health. There are ways in which we need to involve our CCOs and others in coming up with the vision that I believe CCOs came under, which was taking care of the whole person and including behavioral health as part of that. So thank you.
Thank you, Senator. Representative, any other additional thoughts on behavioral health for us, and especially thinking about the workforce as well?
Well, good morning, and thank you for having me. I'd like to make a couple of comments, and the first one is I believe that the work that the late Representative Mitch Green left us for the behavioral roadmap that he spoke so passionately about truly speaks to me, and I think an opportunity that we have to truly assess what we have, what works, what doesn't work, and where to put those investments. And I believe that Senator Steiner Hayward's comments that we're paying for things that aren't evidence-based. And I think that's terribly important in healthcare, that we make sure that we're looking at the best practices and we're looking at the outcomes, that we can actually have things in place on the ground, the boots on the ground, delivering the services that need to be delivered across all communities, regardless of where they are or who they are in the state of Oregon. So I'm terribly excited about that opportunity. And then the other piece that I see as fundamental, while new to the legislature, I have followed the CCOs for literally years now. Here in Marion County, former Commissioner Janet Carlson did a tremendous work around the CCOs and having that come to fruition in the county. And I see that as very important work that we need to continue, and integrating into the CCOs and primarily into your primary health care. The behavioral health component to me is very, very important. As I was listening to Senator Roblan, the thought went through my mind, why aren't we teaching? Why aren't we providing ways of relieving stress at a very young age? Why hasn't that become part and parcel of our conversations with our healthcare providers when parents are in with their children? So I could go on, but thank you. I think you hear my passion. So thank you for the opportunity.
Well, I appreciate your passion. I appreciate your comments about the late representative as well. I think we all appreciate the work that he has done and look to him and the work that he did for all of us as we move forward. Representative Prusak, welcome. Good to see you. And since you're one of our providers on the panel today, we'll give you this one as a little bit of a softball to talk about preparation for a vaccine and preparation for what could and should come around COVID-19, and any sort of policies that you would think moving forward, or the state should be preparing for, or the healthcare community should be preparing for as we look towards the future. So I'll stop there.
Thanks. Good morning, everyone. Really great to see you all and be a part of this discussion. I find it interesting that you're calling that a softball question, a vaccine for a novel global pandemic. But I'm going to kind of take it back a little bit, and not necessarily about the creation of the vaccine, but where we are as a state and access to primary care, where most people access their vaccines. And although Oregon has a robust healthcare safety net of 200 community health centers utilized by 400,000 Oregonians for primary care, lack of access to affordable primary care is associated with poorer health outcomes. And so what myself and Raquel Moore-Green, with the support of Rep. Salinas, is doing and is sitting around a table, a Zoom table, with 22 members of a very clinician-heavy member work group with a lot of primary care providers, which makes up the nurse practitioner, the physician, the naturopathic physician, the nurse, the social worker, counselor, behavioral health advocates, and pharmacists, and really with also administrators, hospitals, payers, insurers, and really looking at, while we have people that are mostly insured, while we have all of these clinics across the state offering primary care, what are the barriers still? And so we're really looking at that, because if there's barriers to accessing primary care, there's going to be barriers to accessing the vaccine. So whether the vaccine is here, like some believe, at the end of the year or it's next year, we need to make sure, whether you're in an urban area or rural area, you can access it. And that would be removing the barriers to primary care and all others that can offer it. I'm really thankful to hear also about the discussion about behavioral health. We're also looking at making sure that behavioral health is included in primary care in whatever way possible. So really looking at our payment structures and how we're set up to offer both under the same kind of comprehensive integrated care. I know there's more questions ahead about vaccines, so I'll just stop there. But we'll just again highlight how important it is that we address accessing primary care so everybody can access vaccines. And I remember when the pandemic first hit, and as part of my work meeting with all the clinicians that I work with who serve the vulnerable members in my community, we kind of looked at the first wave, the second wave, the third wave, and the fourth wave of what this pandemic would bring us. And I think that fourth wave is really addressing the community members that didn't access their vaccines as one of them, didn't access care to address their chronic conditions. And then I'd be remiss if I didn't do a little plug for telehealth. And while you cannot get a vaccine through telehealth, if somebody else that needs a visit that day gets their visit by telehealth, then there'll be space in the clinic for a safe visit for your vaccine. And I'll stop there.
Thank you, Representative, and really appreciate the conversation on access, because I think everyone here would agree that that's the first step in order to even have that conversation around access to a vaccine whenever it comes. So I appreciate you leading that part of the conversation. Senator Knopp, let's go to you to talk about vaccines, whether it's a COVID-19 vaccine or vaccines otherwise, and the state level conversations that we've had not only in the past, but we will continue to have in the future around vaccines. So why don't you go ahead and lead us further.
Oh, thank you, Sean. Yes, I think Representative Prusak got one of the key elements of it for sure, which is access. Another element, I think, is education. I think it's important that government has a role in educating the public. And then I think one of the other significant elements is transparency. The government needs to be transparent with the safety trials as it relates to this COVID-19 vaccine. It's being, rushed to market. Most of us know that vaccines take 4 to 5 years before from development to launch. And this one, if we're to listen to those who are saying get ready before the end of the year, it'll be less than a year with this particular vaccine. So the whole transparency with government is going to be critical for the public to trust in the vaccine, the safety trials that have happened, and then of course, the education that takes place through the access with providers. And it's clearly, a vaccine is clearly going to be part of the future for this particular pandemic. And so, and managing it in some way. So I think those are the key elements. And, I think government's role really is to make sure that we're providing that education and asking for government transparency and trying to assure and ensure access for all of our constituents for that.
Thank you, Senator. And let's stay in the same chamber to continue to talk to another one of our providers on the panel, Senator Steiner Hayward. One, thank you for your leadership in this conversation in the past. Again, not only on the COVID-19, obviously that's going to be a future conversation, but on the vaccine conversation generally. I know it hasn't been an easy conversation in the past, both publicly and in the legislature. So I want to acknowledge your leadership on this work previously, but talk about how we're going to navigate this conversation from your perspective, not only from a legislative perspective, but also from a community and healthcare perspective, and how we as organizations can also help in that conversation with patients.
Thanks, Sean. First, I want to start by adding on to Senator Knopp's comments. His points about safety and transparency are really important. And I've been very reassured over the past couple of days when all of the major players who are involved with vaccine development in the United States have come together with a pledge to not seek FDA approval prior to having adequate phase 3 trials. Despite some claims that there's going to be an emergency use authorization for this through the FDA commissioner, Commissioner Hahn, has been pretty clear that that's not a good idea, and he'd be very dubious about that for exactly the reasons Senator Knopp pointed out. We will not have the safety trials. And furthermore, we saw just last night that AstraZeneca, which is one of the large pharmaceutical companies running a trial, actually halted a trial because a patient had an adverse reaction. Now, of course, you can't know with a single episode whether that was caused by the vaccine or just happened to happen at the same time that the patient was on the trial. But AstraZeneca is being very transparent about it, as per Senator Knopp's important point. They've gone very public with it. Nobody's questioning it. Everybody agrees the trial should be halted for now until they investigate it further. So I personally am reassured by all of these vaccine research entities, manufacturers, coming together and saying, we're going to take the high road here. And yes, whoever got first out of the gate could, in theory, gain some significant benefit, but the population would suffer a significant detriment. So I'm very reassured by that. I'm reassured by the transparency about the phase 2 and 3 trials that are going on, not only in the United States, but around the world. So that's the first thing I comment on. The second thing I'd come in, I'd certainly reiterate Representative Prusak's comments about the importance of access. I think we need to remember that probably 5 years ago, Sean, you might remember better than I, Senator Knopp, we were on health policy together then. We passed legislation that said normally pharmacists can only give routine immunizations to children 10 and people 10 and above. In the context of a public health emergency, which this is, we passed legislation they could give for 3 and above. And I think we're going to have to remember that pharmacists could be a really important access point because most people are used to going in to their pharmacist, obviously for prescriptions. They are a trusted source of information. They have a lot of experience in training, educating people about the risks and benefits of vaccines. And people are used to going in there for routine immunizations like flu shots. So that's going to be a really important resource in addition to primary care that we're going to have to think about. We're also going to have to be sure that this qualifies as an essential health benefit. So regardless of one's insurance, there aren't copays for it, because we will not be doing anybody any favors to require copays that might prevent somebody from getting the vaccine. And last but not least, I think we're going to have to rethink a little bit about some of the laws in Oregon around vaccines, particularly for adults working in high-risk occupations. Currently, Oregon law says that employers can't mandate that people get immunizations to come to work. there's been progress made with regard to flu vaccines. Our rates have gone up in hospitals and long-term care settings, but they're still not anywhere close to 100%. And that the medical indications, at least for flu vaccine, the medical reasons you can't get immunized are very, very rare. So I think we need to be thinking seriously about, if we're going to protect a large population, especially in high-risk environments like hospitals and long-term care settings, do we need to rethink that allowance that says employers can't mandate this? And I get freedom of choice and I get all that, but at some point the common good, especially the good of the people being served in those institutions, may need to take precedence. So I think we're going to have to rethink that a little bit.
Drazan, do you want to make some comments around that? Because I know in past sessions we've had some robust conversations around not only that topic, but also sort of vaccinations generally, around the state's role and mandates, whether they be schools, whether they be workplaces, et cetera. So I'd appreciate some comments from you on those topics.
Yeah, thank you, Sean. So Senator Steiner Hayward again is really passionate about this particular issue. And I think from watching what's happened in this COVID environment, the thing that has been a lesson for me is the extent to which politics can engage in a healthcare discussion and create a level of complexity that would otherwise not be there. So, you think about this question of masks. And wearing a mask seems like if that prevents the spread of, COVID-19, you wear a mask. And then it became this political symbol somehow for a period of time, where if you wore a mask, you were, you cared about your community. And if you didn't care and you were selfish, or some other version of that. And I only say that in relation to the vaccine conversation, because what I hope happens when there is a vaccine, which we so desperately need for this, that the conversation starts with our providers and their patients. And I think that lends credibility. And I think that if you have a dependable process by which the vaccine is approved, and if it can, in fact, be given with confidence within the medical community to the public, then the place where that confidence is built and where the vaccines can kind of establish a foothold and continue to protect the population will be with providers. And I think that relationship is critical. I think that that's the right voice. Rather than politicians, to begin. I think the place to start is in the doctor's office, or forgive my old-fashioned terminology there, but I really do think that is where we can get the best compliance with a need to have the vaccines widely used. And I think any conversations about who is mandated to get the vaccine and when and under what circumstances, hopefully that'll be down the road enough so that we have some experience with this vaccine and we have some acceptance within our population that's based on the credibility and the relationship with their own providers. So I do think that as politicians, we have a little bit of an obligation to turn down the heat, if we can, on this question of vaccines, and to not wave a mandate flag before we even have a vaccine, if there's a chance that we can get compliance and acceptance and confidence in the vaccine through our healthcare community rather than through political means. And my concern is that once you make it political, it's really hard to pull back from that. So I guess that's my comment on the vaccine universe. I'm really anxious for there to be continued progress in this category, and I know everybody is. I just think that we need to, as electeds, treat it very, very carefully for how we talk about it and how we move forward on behalf of our communities.
Representative, speaking for myself here, I really appreciate your comments around the politics, especially around the masking issue. Around it was a science-based initiative, and it became something else for whatever reason, for whatever purpose. And I really appreciate you leading with that kind of a conversation as we approach what will potentially be and likely be a considerable challenge for us as not only a state but as a nation as it begins to roll out, as we've seen with other issues around vaccination. So appreciate that. Sort of moving to another conversation I think is going to be, that was a challenge and was highlighted very unfortunately, but very importantly. And Representative Salinas, you highlighted this in your opening comments. One of the real lessons around the COVID experience to date, which I think shined a really important light, is the real inequities in the system. Around Black, Indigenous, people of color, and how the system is just not doing justice to those people of color, and how we move forward from here. So I want to start with you, Representative, to make sure that we give this conversation what it deserves, and at least talk through a little bit of how you see that conversation moving forward, and any policies or focal points you think are important to sort of consider as we look to move forward.
Thank you, Sean. Yeah, this actually has been a major focus of my work through the pandemic, I think, because, I mean, we've known for such a long time that these health disparities and inequities exist for our BIPOC populations, but we haven't seen it in real human life terms the way we have until this pandemic. So kind of going back to, testing, treatments, and what a vaccination will look like, I am concerned. I don't know if folks on the call watch or read Kaiser Health News, but a few days ago, they came out with something that said that there's a real concern with our local public health communities and their ability to actually distribute these vaccines. We don't really have the infrastructure. And that's kind of what I've been seeing throughout this entire process, is that public health and the Oregon Health Authority and our provider communities are not really working together. And so there's just been a lack of, to start with, data. And so I started off focusing on the collection of real D data. So as folks may recall, back in 2013, the legislature passed a bill giving the Oregon Health Authority to collect race, ethnicity, language, and disability data. And they proceeded with rulemaking around how, in other words, in what form healthcare providers would provide the real D data to OHA, but there was nothing in statute that actually required those providers to collect the data from patients. So the data hasn't been collected. And now, obviously, as we see during COVID, our public health officials are scrambling to disaggregate data to figure out what we're really dealing with our BIPOC populations and those with language barriers and disabilities. And we don't really have the data in sufficient measure. So in the first session, I worked with providers and OHA, and I was really grateful for everyone who came together to essentially figure out how we start collecting that real D data. And I know they're going through the RAC, and I think today, actually, they're having their second meeting on that. And the idea is not to duplicate what we're collecting, and we know that folks who have coronavirus encounters with their patients, that we should be figuring out what these populations look like and how do we address it from a population health perspective. I've also been working with the Oregon Health Leadership Council and OHA to make sure that providers have an exchange of electronic health records to evaluate, treat, or coordinate care for patients who have been tested for the coronavirus. We know that this could also be a great piece to that puzzle. And then finally, I think we need to make sure that patients can understand the care that they're receiving with certified and qualified healthcare interpreters. Not everyone speaks English or speaks the language at all. So for our American Sign Language communities, we need to make sure that certified and qualified healthcare interpreters are available. And then this is a policy that I started working on in 2019, and I hope to get over the finish line so that providers actually use this. But there are lots of small pieces like this that are part of an infrastructure that doesn't really exist right now. So I'm really appreciative of all the providers that have come together and OHA. I know sometimes moving the bureaucracy is so difficult, in such a short time frame, and being able to do it right now during this pandemic, and then let's keep the door open for longer term population health, again, knowing that these disparities and health inequities have always existed. So that's a lot of the work that I have been trying to do. But in terms of our local public health and distributing that vaccine, I mean, we got federal money to do it, but so many of our local public health folks are actually using that to respond right now. So I'm really concerned about what the next phase looks like in distribution.
And really appreciate your focus, especially on the data side, to making sure that we understand where those focus areas need to be, and then be able to think through how we drive those policy solutions in the appropriate places. So I really thank you for that. Senator Roblan, want to think through this focus area too as well, in terms of your leadership in behavioral health as well. So any comments in the space for you that sort of ring true? Senator, you're on mute. Senator, you're on mute still. Whatever you said was great, though. So just repeat whatever you just said.
I was just starting with, this has really been a big focus of mine. And as I look at our panel here, I appreciate everybody on this call, but it doesn't look very distributed amongst the populations that live in our state. So I think the first thing we have to do is to really reach out to people. You talked about workforce before. We have to realize that a big part of our workforce are those people who have had experiences in their own lives and can be mentors to people who are having problems, whether it's behavioral health or others. And we've got to figure out a way. Many of them have records that don't indicate that they should be the person in providers, but they have changed their lives. Their experiences bring a whole lot of credibility when working with other people. So we need to figure out how to get them certified, how to make sure that they are being safe and delivering correct messages. And we need to make sure that we start not looking just at the healthcare, but looking at community leaders who people trust in each of these different BIPOC populations, and engaging them with information, that transparency that Senator Knopp talked about, so that they feel comfortable. Our history with respect to these populations, I have spent a lot of my time in this with respect to Native populations on the Legislative Commission on Indian Services and others. There is no reason why our Native population should trust anything we do in healthcare. They have been used repeatedly in the history of our United States as experimental subjects. We have done really horrible things with respect to them through healthcare. So why do we now expect that they're going to trust us to do what's the right kind of thing? So how do we engage those populations in understanding that right now we want to change that? And that means we need to actually engage in the leaderships in each of those populations to give them as much information as we possibly can, be as transparent as we possibly can, so that they build trust again in our communities and in our populations that are providing those activities. So again, it's something we have to work on. It's something that we need to make sure that we engage in. I know that Senator Lou Frederick has repeatedly tried to figure out how do we get more teachers of color into teaching in classrooms, because you see them, we need the same thing in all of our provider groups. If we really want people to believe it, you know, one of the things that I was for and a number of people had a hard time with was a dental program that came out of Alaska with Native organizations. For one of my tribes, that was probably the single most important thing that we have done in a number of years, because all of a sudden they had their tribal members being trained actually in Washington to come back down here and provide oral health, which now we all know is a real big indicator of what all physical health is. So again, we've got to come up with opportunities to make sure that we build a trust amongst all the BIPOC populations.
Thank you, Senator. And I really appreciate your passion in this space and the acknowledgement that we need to talk to those communities and those individuals to really understand what the needs are and not. And to your point, looking at this group, we need to make sure that we're listening first and foremost. So really appreciate that. Representative Prusak, we'll just go right to the provider lens on that piece and sort of the workforce lens, teeing off what the senator said. Any perspective and any policy solutions in terms of diversifying the workforce to making sure that we're listening and driving into that space from a policy perspective?
So first, I'll acknowledge we're in a fight to find a vaccine for the global pandemic for COVID-19. And when we find that, we need to make sure that those most impacted have access to it first. And that's going to take education, as mentioned earlier, by those of us that serve our communities. And I spend a lot of time educating my frail elderly, my frail disabled patients and their caregivers about the importance of it and give them the real education. And I think that was mentioned earlier. And what we also need to do is stop the misinformation. I think that is one of the key things that will be really important is how do healthcare clinicians educate those that have been harmed by our healthcare system in the past, and then stop the misinformation. As a nurse practitioner for 20 years, I have seen clearly the health disparities related to institutional racism from a public health perspective, whether it's us not listening to patients' report of pain, whether it's watching Black mothers die of pregnancy. And so it is true that for so long, we have created a system where there isn't trust. So I just want to drive that home again, how important it is that clinicians are able to educate and politicians are able to stop the misinformation that's out there. As far as policy, I know that on the work group that I'm chairing, and again, Representative Moore Green has joined me, we are looking at everything with the social determinants of health lens. And at one point I showed a video on really what that means and that historical systemic racism that's existed. And with every policy that we're looking at on that work group, there is a way for us to address the social determinants of health. And I'm asking every member on that group that's a clinician or a payer or a hospital system, you know, what are they doing now and what do they think that they can be doing? So, and then, you know, I remember when we were just learning about this novel pandemic and we were getting informationals from Oregon Health Authority in our healthcare committees in the Senate and the House during our short session. And I specifically said, our BIPOC communities are those that are working in our long-term facilities, those working in our hospitals that are often overlooked. How are we going to make sure we care for them? And then, you know, we did see in our long-term care facilities more of an outbreak. And that's where I go and I see my patients. I was hopeful when I saw that we're offering testing to everyone. I do worry about us having the capability to continue that. We're all getting tested once a month. I worry about the capability of us continuing that. And then I worry about how we're going to support those workers that need to take 2 weeks off when they do test positive. So I think it's really important that we look at policy to support our workforce during the time that they might need to be quarantined, and that as we look forward, we're educating, we're stopping misinformation, and we're making sure that those impacted most, those working in our healthcare systems, are BIPOC communities that are being disproportionately impacted by the COVID pandemic, that we get to them first. And hopefully there's a way for us to address that in policy.
Thank you, Representative. And then Representative Moore Green, thoughts on the clear disproportionate impacts in communities of color, and then also want to link up to Representative Prusak's work group and the work that you've been a part of in that conversation. So any thoughts here?
Yes, and thank you, Sean, and thank you for all the comments leading up to this. And I want to echo many of them, and I want to specifically talk about building trust. Here locally in Marion County this past spring, when the pandemic hit and it became very apparent that the BIPOC community was disproportionately affected, immediately with our colleagues throughout the community, so not only other legislators locally, but we had commissioners, we had city officials, and we had nonprofits, we had the faith community, we had everybody at the table. And what became very, very apparent was that even within the communities, there was distrust within their own communities and among their own fellow members. And I think it's terribly important that we build that trust, that many of them come from backgrounds where public health is not something in the countries that they come from, something that they can trust. And I think for many of us, it is something that we trust. So how do we demonstrate that to them? How can we pull them into the fold, understand what their concerns are, address those concerns? Concerns down to who's translating. So here we have a native language that is not translated on a regular basis, and trying to find a translator who is qualified or meets the certification in order to translate. And with the patient needing the services, not trusting that translator. They didn't know that translator. They wanted their daughter or their son or a niece or a nephew to translate for them. These are terribly important personal things that take place in healthcare, and I think trust needs to be built. And and we need to reach into those communities and ask them, how can we help do that? What do we need to do to help facilitate that? Because we want to help. We're here. We're in this together. We need a healthy community, and that means everybody. And I think then that goes back to what Representative Drazan touched on, that if indeed for a future vaccine, if that trust can be built among the healthcare workers and translated to the patients and then out, I think that's where we're going to see our greatest gains. And perhaps that's the way, we will see gains overall in public health moving forward. And then Senator Knopp's comments around education, access, and transparency. Here again, these are part and parcels to building trust. And how are we going to go about doing that? And how am I going to hold myself accountable as a legislator in doing this moving forward with policy? And so that does take me back to the work group that I've had the privilege to serve on with Rep. Prusak. I am probably the only non-healthcare person on the committee, but I do bring a fresh set of eyes and a different set of questions to the table. And as she mentioned, as we are moving through the policy pieces, and we're doing this slowly, we're not rushing anything. It will be a labor of love by the time we get done with our first report. That we bear in mind, how does this affect communities? How can we have the BIPOC communities, the communities of with ethnic diversities? How will they perceive this? How can we wrap them into these processes and move forward in a way that will make every Oregonian healthier?
Thank you for that. I think I really appreciate the listening part of that kind of conversation, making sure that we're bringing that. It's really appropriate for where we are in 2020 at this moment with all of the issues that are facing us. That sort of leads us to our sort of wrap up here. I know we're really tight on time here, and we want to make sure we're good on your all's time. And so we'll sort of wrap with this one last question for everybody, and I'll call on each one of you, but want to make sure that you hear the question, and I'll call on each one of you. One sort of lesson learned from 2020, and it can be as broad as you like. And I'll start with Senator Knopp.
Well, I think really important that we legislate with intent, and with the intent of inclusion. And whether that's healthcare or whether that's taking some things from previous session, like passing the Oregon Minority Voting Rights Act, or making sure when we did paid family leave that we included a broad definition of family, that we include people of color. Same thing with pay equity, making sure it's not just about equal pay for based on gender, but also equal pay based on color, based on sexual orientation, based on lots of classifications. And so I think it's really important that we learn the lesson of including by intent when we're legislating and making sure we're not leaving out those who are a part of some minority, because at some point we are all going to be part of a minority in some way or another. Some people, have that status based on, their birth. But at some point, all of us will be in a minority, and we need to think beyond ourselves and our comfort zone and make sure that we're legislating based on intent.
Thank you, Senator. Senator Steiner Hayward.
Thanks, Sean. I think one of the biggest lessons that I would take from 2020 is that, as Senator Roblan said, we don't make major changes when things appear to be going well, right? When we're not in a crisis, and we are, and it has laid bare so many flaws in our system. I think we're spending way too much on healthcare, and that has to do with our fragmented way in which we provide insurance to people, and it has to do with, I'll be very blunt. I think those of us who are covered by PEB have much too generous benefit packages. I think it's costing the state way too much money to pay for our benefits, and I think it ought to be pared back to be something more like what's available to our OHP members. And I've said that since before I was in the legislature, and I've said it ever since I got in the legislature. I think our CCOs do a great job providing care, and we could get much better health care and focus more upstream on prevention and other social determinants of health if we started to think really hard about the fragmentation in our healthcare system, and understanding that some of those dollars are much better spent addressing educational disparities, addressing housing disparities when people have to live in environments where they're not safe to go outside and be physically active, or where they're not safe to stay inside because there's mold that's triggering asthma, or any one of a number of things like that, where they have food insecurity and so they're not able to eat a healthy diet, where they're having to make choices between buying their medication and paying their rent. Those are all things that we need to be thinking about together collectively, because just as a rising tide lifts all boats, anybody who's chained to the bottom drags all of us down. And we need to be thinking about how to create that rising tide of opportunity, of equity, to take away the things that are holding people back and give people a fair shot to overcome centuries of ignorance on our part and discrimination in so many different ways. So I could ramble for a while about this. It's something I care about a lot, but I think that's one of the biggest issues. We have an opportunity to totally rethink how we do things in this state, in our nation, frankly, around the world, and we ought to be taking it.
Thank you, Senator. Representative Drazan, some final thoughts?
Yeah, thank you. I was thinking about the lessons that I have learned from 2020. Like don't run with sharp objects is how this whole year has felt. That, you just get back to some really basic concept where you realize what it means to take care of yourself and to take care of the people around you. But I do think that we have seen government has extraordinary power for good in an emergency, in a crisis. And it also has extraordinary power to fail and to fail people. And I think that we've seen both sides of that at a state level, at a federal level, sometimes at a local level, where you and I might look at a situation in a crisis and it might just seem clear to us how easy this would be to fix this problem. And somehow, it's just not done. We just can't quite untangle the bureaucracy or the mentality or the systems, and people are left underserved or unserved entirely. And then on the other side of it, we somehow, manage to really, really quickly get a few things right. And sometimes that's working with the private sector. Sometimes that's just working with folks in the nonprofit sector. Sometimes it's just kind of getting out of the way of ourselves. And so I would say that the lesson for me for 2020 is encouraging, in that I can really see how government can really help and support when they see the problem, and there's a will to do it and the resources to get it done. But I also have seen that the opportunities to make real change when we see problems that seem persistent, that for whatever reason, we haven't fully embraced the opportunity to fix some things that are really, really broken. And so I do think that will always be the challenge of government, to take a closer look at itself and do better each day and each year. But I think 2020 has really put some of that on display. So those are some of my lessons from this year. Don't run with sharp objects.
Thank you. Representative Salinas.
Thank you. So I think we have a better understanding of what it truly means in human terms to lack access to healthcare when our Latinx communities have infection rates upwards of 35%, and we only make up 13% of Oregon population. So moving forward, I will certainly be focusing my healthcare policy work around furthering access to care, especially with our BIPOC communities. I also think the pandemic, as Senator Steiner Hayward alluded to, it's highlighted some of these, system problems. COVID coverage isn't really a solution for workers who lose their jobs and with that lose their healthcare coverage. And one's ability to access to care is too precarious when it's tied to employment. I think we also better understand how critical access to data is to providing efficient, effective, and timely care to those on the margins of our healthcare delivery system. But overall, I think I would be remiss if I didn't also say that I think Oregonians have demonstrated true mettle in their response to COVID. We've seen providers shut down critical parts of their business. We've seen telehealth implemented for rural parts of our state. And we've seen a spirit of cooperation focused on our patient populations like we've never seen before. And this all tells me that we can all think more creatively and innovate when our backs are up against the wall. I think as Senator Roblan said, starting out. And like all of you, I can't wait to see the day where my life returns to the freedoms of pre-COVID. But for now, I hope you and your CCO providers join me to envision a future where we don't return to pre-COVID days for our healthcare system, but we actually forge ahead to build something better.
Thank you, Representative. Representative Prusak.
First, I want to applaud everything Rep. Salinas just said, because it gave me hope, and it's something we so need. But 100% is, I've been screaming and yelling about the disparities I have witnessed as a clinician for so long, which was what brought me to run for office in the first place. So I see COVID-19 as pulling the curtains back for everyone to see what us healthcare clinicians have seen for so long, or what our educators have seen for so long. And now everyone has to see it. So we're in a real reckoning of what we do with what we're seeing and how we move forward. On a personal note, what I've learned is how much I miss hugging my patients and holding their hands, because right now I'm wearing gloves, N95, gown. You can't really do the hugs. And if you're holding their hand, you're in gloves. They're in a mask. I'm in a mask. It's really hard. So personally, I miss that. And then the silver lining that I've been repeating over and over again is I tried to pass a telehealth bill last session, was met with lots of resistance. And that silver lining is everybody now sees how important it is that you can access telehealth in a rural or urban area, because those barriers to care that existed pre-COVID are being highlighted. So thank you for letting me share something a little bit more esoteric, personal, and then a silver lining. Thanks.
Thank you. Representative Moore Green.
Thank you, Sean, and thank you for the privilege of being able to sit among my fellow colleagues who have a tremendous amount of experience, of history, and a vision for not only healthcare, but for Oregon. I'm truly humbled to be with you this morning. So thank you for that opportunity. And on a lighter note, Let me just share with you the notes that I jotted down when you posed the question, the lessons learned from 2020. The first caveat is 2020 is not yet over. I am sure there are more lessons to learn. However, these are the three that I would like to leave everybody with today. Each day is new. Each day has its challenges, and each day has an opportunity for me to do something good for my constituents in House District 19. And if I can accomplish that, I've done something good for all Oregonians. So thank you again for the opportunity.
Thank you. And last but not least, Senator Roblan.
Thank you, Sean, again for the opportunity. I want to first say everything that has been spoken from the panel, I agree with. So I won't go back to any of those other than to say singularly what I learned the most. I had an opportunity just before the pandemic hit to go to Baker City and look at a CCHBC in action and spend time out there and talk with a psychiatrist who lives and works in Salem, but is the psychiatrist for that rural community. He used to have to travel there, spend a day over it and a day back. They felt they made a really great room to do telehealth. And I guess the thing that I have learned the most in this year is that is the future. The problem is, as he said, if I could give a laptop or a iPad to each of my patients, they wouldn't have to travel their 4 hours to get to Baker City, even if I'm still in my office. And I could treat them at home. And therefore, what we really need to do, and I think focus on, we're doing a better job. We have done a really poor job the previous number of sessions. We've left a lot of federal money on the table. We need to get high quality broadband to every house in the state of Oregon. That's what's going to make the change changer. It'll change money. It'll change everything else. So we have to figure out, how do we continue to improve on access everywhere? We've done it with electricity. We've done it with telephones. We can do it with the internet. And we talk about rural areas needing it most, but I will tell you that there's a real problem in inner cities as well with access, because people don't have the equipment. We need to make sure that, like everybody else, access is not contingent on you having enough money to get the piece of equipment that will get you there. So I hope that all of the things and the lessons learned people will take to heart. But at the end of the day, from my perspective, the real game changer will be when we can say that every Oregonian has access because they can do it from home. So thank you for the opportunity today. And I hope everybody has learned a few things. I certainly have from the panel that you have brought together. So thank you.
Well, thank you all for joining today, and thank you for spending an extra 15 minutes with us. I know we're very much over time, but I want to thank you for joining us today. And I think at least the lesson I learned today is that I'm very terrible at time management on a Zoom call. I'm much better in person, so we'll leave it at that. Thank you all. And for those of you who are staying on for the panel, there is no break. Right, Samantha, and we're going to just move right into the next panel. So thank you all, legislative leadership, for joining us today, and really appreciate your time and leadership and continued conversations moving forward. Thank you, everybody. Be safe today. Thank you.
Thank you.